I'm Dr. David Schneider. I'm one of the orthopedic surgeons at Panorama Orthopedics and Spine Center. We're going to talk today about elbow arthritis. Elbow arthritis is relatively rare compared to the other joints of the body, and many fewer total elbow replacements are done in the United States compared to shoulders, knees, and hips. The most commonly replaced joint in America is the knee, and a very distant fifth place is the elbow. However, when someone has extreme elbow arthritis, whether it's from disease such as rheumatoid arthritis, or whether it follows trauma with the resultant post-traumatic arthritis, an elbow replacement is a wonderful thing. Here at Panorama, we do more elbow replacements than any other institution in the Rocky Mountains. If you look at the elbow anatomy, it, like every other joint, has at least two bones that come together. In this case, it's three bones. And the articular cartilage is on the end of the humerus and on top of the ulna and on the radial head that you can see hidden behind this ligament. So the elbow joint itself is a simple hinged joint, just like the knee joint, for instance. But in addition, there's the radiocapitellar joint, so you can see the radial head hidden behind there. The radius interfaces with the capitellum, and the ulna humeral articulation is this hinge joint that interfaces with the end of the humerus. In post-traumatic arthritis, someone suffers a fracture or a dislocation, and it leads to severe wear or injury to the cartilage surfaces. When that happens, sometimes the only option is an elbow replacement. An elbow replacement is this very specialized implant. The one we use is shown here in this sample. This is real size with real materials. You can see it's a combination of a humeral component that fits into this bone and an ulnar component that fits into the ulna. It's done through a simple incision in the back. We expose the elbow, and we're one of the few places that does it with the triceps tendon remaining, so it makes someone's rehab much easier. The operation is then done by removing a small part of the bone. This stemmed implant goes up the hollow part at the end of the humerus, and this component as well, the ulnar component, also then goes down the hollow part of the ulna. The thing that makes this implant really special is the way that it's slightly loose, and they realized instead of making it a very tight hinge, what had to be done is to give it a little bit of play, and that allows it to last a lot longer. In addition, this polymer, this specialized polyethylene, is treated with vitamin E that helps it be much stronger and wears much less. You can see these x-rays. The implant is placed again in the humerus. You can see it on both sides. And the ulnar component is placed down into that ulna bone. The radius is left alone for the most part. We can also do a limited type of elbow replacement in which we only replace part of the elbow. So in this case, the capitellum and the radial head are both replaced. And in between there, in intervening area, there is the polyethylene implant. So we can either do a partial elbow replacement or a total elbow replacement. After someone has a total elbow operation, keep them in the hospital overnight, at least one night, and they have a big fluffy cast on their arm. And then they can go home while resting that arm. We get them out of that cast, that splint, after a week, and then we get them moving their arm. At about the 3-month mark, most patients who have a total elbow have dramatically improved range of motion and dramatically improved pain control. In our series, most of the patients that have a total elbow are rheumatoid arthritis sufferers, but because we run such a busy trauma center, a lot of our patients are post-traumatic arthritis patients whose elbows have been destroyed by trauma. Both those groups of patients get to really benefit from improved range of motion and pain control that a total elbow provides.